Good morning, everyone, and thank you so much for joining us today for our second installment of a webinar on House Bill 1407. My name is Ellen Jensby. I'm the Senior Director of Public Policy and Operations at Alliance, and I have here with me Emma Hudson, our Director of Community and Government and Community Relations, and she will be talking a little bit later in the webinar. For your reference, all lines will be muted for the entirety of today's webinar to preserve call quality, and because we have a lot of information to fly through in a limited amount of time. So if you'd like to ask a question, you can type it into the chat box. We'll do our best to answer anything that's relevant to all participants today. But if we get additional questions, we will send them out with the follow-up to this webinar, including the slides, as well as the recording of this presentation. We're going to do our best to keep it within an hour today, but we do have a lot of content to get to, so we might go a little bit over. But we will have this webinar archived on our website and publicly available for anyone to listen to at a later date. With that, I will advance the slide. All right. So briefly, we'll just go through what we're going to talk about today. We're going to briefly discuss what Alliance is, some definitions that you need to know in order to understand the content of this webinar, a little bit of background on the legislation, the primary elements of the law, the rate increase details, which we know you are all anxious to hear about. We are covering a lot of detail on the rate increases now that we know more. We're also going to cover information about the new DD Waiver Resources and new Caregiver Emergency Criteria details. We'll briefly discuss how you can help with the implementation of this law. And then finally, we will try to get to any questions that were entered in the chat box if we have time. Alliance is a nonprofit statewide association of community-centered boards and program-approved service agencies. We have, when you consider all of our members' various locations, over 80 members. Our members serve more than 10,000 individuals with intellectual and developmental disabilities in Colorado, and they serve approximately 80% of people on the developmental disabilities, or sometimes called the comprehensive waiver. We want to go through a little bit of alphabet soup for you today so that you can understand everything on the webinar slides. So of course, when we say IDD, we mean intellectual and developmental disabilities. When we say HCPF, we mean home and community-based services waivers that are through Medicaid, including the developmental disabilities or comprehensive waiver, the supported living services waiver, and the children's extensive supports waiver. Those are the three primary waivers that support people with IDD in Colorado. When we use the words resources or enrollments, we'll probably be using those interchangeably. We mean a waiver enrollment. And today we're going to primarily be talking about enrollments to the developmental disabilities or the comprehensive waiver. We might say that as DD comp just to save on time. When we talk about DSPs, we're referring to direct support professionals. I'm sure all of you have heard that term before. And so we're going to be talking about them sort of, there's a difference today between sort of the colloquial usage of that term DSP and the technical definition that's in the legislation and the rules that we're going to be discussing, which we will provide to you as we move along. HCPF is the acronym for our state Medicaid agency. It's called the Department of Health Care Policy and Financing. We're going to use that acronym primarily today. All right, we wanted to just briefly cover some items that we covered in our previous 1407 webinar, which is archived on our website. You can go back and listen to that. These are items we're not going to cover in detail today, so if you have more interest, you can go back and watch that webinar. These include the funding mechanisms, including fee-for-service reimbursement, which is how our waivers are reimbursed. And that means that rather than a lump sum payment going to providers or community-centered boards, they are paid as a reimbursement, so they get a fee on the back end after they provide a service. In that webinar, we also emphasized the fact that there's a lack of other revenue streams for IDD services, and that for most agencies, they are at least 90%, some up to 98% Medicaid funded. So that is the vast majority of our services. We also discussed the problem we're trying to solve, which is what we call the financial perfect storm, which is a variety of economic factors that result in access problems and reduced provider choice for people with IDD and their families, and people without needed services on the waiting list. We also talked in detail about how the bill passed and its supporters. Now I'm going to turn it over to Emma to provide a variety of different content about the 1407 rate increase. Emma?
Good morning, everyone. Please let us know if you can't hear us at all, or if anything is unclear, please use the chat box as Ellen mentioned. All right, let's get into the nitty-gritty details here. So, what was included in HB 1407? So, as probably the reason most of you are on the webinar today is because you've heard about or have already started implementing the 6.5% rate increase that was included on most IDD waiver services. We're going to dig into that a lot today. Also included in the bill were 300 non-emergency, so meaning just off the top of the wait list, DD comp waiver enrollments. I know that was very exciting for many of us, given that the waiting list hadn't seen much movement in quite a long time. So I know there's almost 300 families now. They're still onboarding, but it's pretty exciting. The third thing included in the bill was a path to help families with a caregiver crisis. So anybody with a caregiver concern or caregiver with a terminal illness will now have a path to come off the waiting list. The cost of the bill was no small matter. The total cost of the bill is about $70 million per year in a combination of both state and federal funds. All right, so let's really dig in now. Okay, which programs actually received the 6.5% increase? These are the ones that did include the increase. So waiver services, exclusively just 3 waivers: the DD comprehensive waiver, the supported living services waiver, and the children's extensive support waiver. Just those 3 waivers. So I'll say it again, just the DD waiver, the SLS waiver, and the CES waiver. The EBD waiver did not receive increases. Like, there's none of the other many waivers did not get an increase. All right. The other things that did not get an increase were, for example, state plan services. So targeted case management did not see a 6.5% increase last year. Early intervention, etc. The state-funded services, so state SLS and FSSP, the Family Support Services Program, also did not see an increase. Lastly, we want to be clear that local mill levies, so for those of you who live in areas where there are local mill levies or services funded by local mill levies, the bill itself did not include funding for a 6.5% increase on any mill levy funded services. That does not mean that your mill levy may separately choose to increase those service reimbursements, but it's not part of this bill. Okay. All right, so which services did qualify? Here you go. Here's the list. So again, it's these services on the 3 waivers, DD, SLS, and CES waivers only. So for some of these services, there are a few kind of subcategory or sub-services within these services. Those are part of the umbrella of that service that did get a 6.5% increase. If it is not on this list, it did not get a 6.5% increase. So that is transportation did not get a 6.5% increase, which we explained in the previous webinar. Vision and dental and targeted case management and a few other services did not get a 6.5% increase, and therefore you do not see it in this list. So what about those other services? Those other services did receive a 1% across the board rate increase. So they did not get the 6.5% that all the services on the left hand of the screen got, but they did get a separate 1% increase. So targeted case management, transportation, et cetera, did get that 1%. Okay. Also, we just want to let you know that actually this year, the state budget for the upcoming year closed yesterday, and all providers will see an additional 1% increase on all services that will go into effect on July 1st, 2019. So you have another 1% coming on all those services. So you'll see that arrow there because there's a little bit confusion, right? Because all services got a 1% increase last year. That means that the services on the left that got a 6.5% in total received a 7.5% increase. Okay. So this is not just obviously about services. We want to make sure that people are really accessing more services, right? So we also made sure that the service plan authorization limits in SLS and the spending limits in CES increased so that folks can really, really benefit from this bill on the ground. All right. I know that this is what a lot of you came for. How does this work? The billable rate for each unit of service was increased on March 1st, 2019. So for example, if the rate for homemaker services was $3 per 15-minute increment, that amount, the amount you bill for and the amount you get reimbursed, went up 6.5%. All right, but now how do I calculate the rate increase for my agency? This is a hyper-simplified version, but essentially you look at the amount of money that you received from these services from the start date of March 1st through the end date of this accounting or reporting period, which is the end of the fiscal year on June 30th, and then you subtract the amount that you would have received under the old reimbursement rates. So you'll just look at what additional amount you got via that 6.5% on the top of those rates. And that is the amount of money that you will ultimately need to be able to prove that you spent on DSP compensation. We'll dig into this a little more and provide a few examples. All right, we want to be clear. There's nothing in the bill or the rules that mandates you have to do this prospectively. You don't have to necessarily be able to estimate perfectly exactly how much money you're going to get from that 6.5% rate increase in the future. We recognize, and I think the state recognizes, that services are fluid and people's lives are fluid, and I think especially for smaller agencies, it can be really hard to predict exactly how much you're going to bill on each service line each month over time. So you are not required to look into the future and into your crystal ball and try to figure out exactly how much money you're going to get. I know many agencies are trying to look at that so that they can estimate how much money they're going to have to spend for their budgeting purposes in order to give these wage and compensation increases, but you certainly do not have to. You can do this retrospectively. A lot of agencies are going to do a combination of a prospective and a retrospective approach. They're going to estimate how much they have to spend and then conservatively spend a portion of that funding on DSP compensation, and then at the end of the billing period or reporting period rather, after June 30th, they will look at in reality, how much additional money did they get due to that 6.5%, and they'll use that final amount, anything above and beyond what they've already spent, as bonuses or some other way to increase DSP compensation at the end. So we'll talk a little bit more about that. I want to go through, just last night as we were looking through this, I said, actually, I think we need some clear, somewhat clear agency examples. So we're going to quickly go through a few of those that we reached out to some of our friends last night, and they quickly sent us how they're looking at this. So here's a couple agency examples. Agency 1. So they said the first step, overall, we applied the 6.5% to all of the applicable rates and came up with an estimated pool of funds. So they looked at, over the next several months, on average, here's how much we anticipate, based on historical data, here's what we think we're probably going to bill, and here's what we used to bill for that amount, and how much the 6.5% increase is going to maybe come out to be. So they came up with an estimated pool of money that they're going to have. Then they built a spreadsheet that included all the salaries and related expenses for people who qualify as DSPs. And as we will talk about, host home providers do qualify as DSPs for the purposes of this bill. Then from that, they were able to start to play with how the increases would use up the funds. So they were able to kind of pull levers and say, okay, if we increase host home provider wages X amount, we see that, the pool of funds goes down and we have less to spend on day program increases. Or if we put more over here in health insurance, we have less to spend over here on our respite program or whatever it might be. They decided to roll out the increases early on January 1st. So this particular agency is actually using the 4 months of funds in 2019, right, because they're getting March, April, May, and June, so that's just for this accounting period, the 4 months of those funds over the course of 6 months since they implemented it on June 1st. They said for the purposes of their tracking, they're going to track both expense and revenue in a spreadsheet so that they can really demonstrate the difference between what they would have gotten without the increase and what they will get and spend with the increase, so that they are able to very clearly show healthcare policy and financing in any auditing or reporting exactly how they spent the money. And so because this particular agency chose to spread that 4-month allocation over the 6 months, and they instituted those wage increases early, they know that they're going to give another increase in July to annualize for next year's spending, because the next reporting period is a full year. This one happens to be 4 months only because the rate increase went into effect on March 1st. Next year, the entire accounting reporting period will be from July 1, 2019 until June 30, 2020. Okay. Agency 2. So this agency is estimating conservatively approximately about another $1 million in new revenue based on the 6.5% alone. So just that 6.5% on top of their services, they expect an additional $1 million. So that's an actual low budget estimate, and they're using that to make all of their distribution choices. Any money on top of that, at the end of the accounting period, they're going to use as a bonus pool for their eligible DSPs. So this is how they chose to allocate it. So they're saying 54% of that $1 million went to DSP wage increases that started at the beginning of this month. They also used 6% on additional premium matching for the DSPs who have health care. They also used the money 10% on increasing vacation time. Particularly, it looks like they wanted to incentivize earlier DSPs with vacation sooner in their kind of development at the course of their agency. And then they calculated they'd already spent about 30% of the funding because they instituted some of these increases early, right? We'll talk about the time period, but I know many agencies were pretty desperate to get this increase in place, and so they decided to go ahead and do it early. So some agencies have already spent a portion of this 4-month increased funding. All right. Altogether, this particular agency said 79% has gone to DSP direct wage increases. So the rest, the other, I'm not great at math, 21% has gone to other types of compensation. So vacation time, health insurance, whatever else it might be. We'll give you a list of allowable expenses in a little bit. All right, agency 3. So they estimated that they would get $140,000 in additional revenue, and their wage increases 6 months of additional mandatory minimum wage increases cost them $95,000. So this is an agency whose DSPs were under the new minimum wage that went into effect on January 1st. So they had to increase their minimum wage employees to be in alignment with the new minimum wage, the $11.10 mandatory state minimum wage that went into effect on January 1st. So they absolutely had to spend this $95,000, and they had to do it before January. So they already spent $95,000 of their $140 before March even came. They also increased DSP supervisors by 90 cents per hour above the minimum wage because, you know, obviously if they're increasing their low-income workers up to that $11.10 per hour, they're going to have some wage compression issues with their supervisors, so they increased them as well. That worked out to be $45,000. They also had some necessary expenditure with this because, you know, there's the associated increase with FICA, which cost them $7,000. And the benefit premium in their area went up as well, which cost them $50,000, and they chose to they don't want to pass that through to employees to the degree possible. This particular agency has eligible expenses of $197,000, and 152 of that was outside of their control, meaning the $50,000 for health insurance, they can't control that. The $95,000 for having to increase their low-income workers to the new minimum wage, they couldn't control that. So they anticipate receiving $140,000 in additional revenue, but actually they have $197,000 of eligible expenses that they can demonstrate to healthcare policy and financing as money that they spent in alignment with the statute. Okay. Last example here for host home providers, Agency 4 here, they said we passed the increase on based on a percent. So just for easy math, let's use $100 per day. So if their host home provider was previously contracted for 70% of the old rate of $100 per day, that host home provider would be paid $70 per day. Using that example, and let's say there's the rate increase on that rate, 6.5% would make it $106.50 per day. They're still contracting at 70% of the new rate, so the host home provider would receive $74.55 per day. What's important here is this agency is still going to have to demonstrate that the entire $6.50 went to DSP compensation. So it doesn't mean that entire $6.50 has to go to this host home provider. They just are going to have to be able to demonstrate that that entire amount went in the aggregate, went to DSPs at their agency. We'll get a little bit more into that. Okay. All right, so what are the timelines look like? Key dates that you need to remember include, obviously, we've said the new rates, the new increased 6.5% rate went into effect on March 1st, 2019, so hopefully you guys are 2 or 3 weeks into this. I know some of you have already billed for this. If you did already bill, I know some of you received a bounce back or incorrect reimbursement in that first week or so. We believe HCPF has already corrected that error. They got on it pretty quickly, but we apologize for that error, and we were very sad to hear it, but it sounds like it's fixed. The compensation comparison date. Okay, this is very important, and I think it's got a lot of people confused, but it's actually a very, very helpful piece of what was included in the statute. So in the statute, it says that HCPF will compare everything to the date of June 30th, 2018. So in their accounting and in their reporting, what you will have to demonstrate is that the entire amount that you receive in a new compensation, so let's say your agency is going to get $100,000 in new compensation due to the 6.5% increase, you're going to have to be able to demonstrate that total compensation for the DSPs, that eligible DSPs went up compared to what they were on June 30th, 2018. This is particularly important because we have a lot of agencies that needed this increase to be eligible right away. So we had a lot of agencies that said, hey, our health insurance costs are going up in October of 2018, and we really don't want to pass that on to our employees. So they chose to basically have the agency absorb those costs while knowing that the increased reimbursement would start in March. And that is an allowable use since it took place after June 30th, 2018. Same thing for the agencies that chose to increase wages in alignment with the January 1st minimum wage increase. So because that minimum wage increase occurred on January 1, Agency 3, I believe, in our examples, had to increase their low-income workers because they were below that $11.10 line. And because of this June 30th, 2018 comparison date, their decision to increase wages up to the new minimum wage will count as allowable expense for the purposes of HCPF's reporting. All right. Okay, so that's just saying in more words what I just said in 10 times more words than that. All right. The deadline for giving these increases. So even though the entire reporting period for this particular year that we're looking at is March 1st through June 30th, 2019, so March 1st, 2019 to June 30th, 2019, Healthcare Policy and Financing has provided 60 extra days past the end of the fiscal year, which lands on, so the end of the fiscal year is June 30th, 2019. They've given 60 extra days past that, which lands on August 31st, 2019, for you to true up the total amount that you need to spend on DSP wages. So you have 2 months after the end to really look at how much additional revenue do we get, how much have we already spent on eligible DSPs and eligible compensation, and then you can take any remaining funds and distribute them as further wage increases or further bonuses or further time off or whatever you choose to do. So you have that additional 60 days after the close of the business year. The last date here that you need to remember is December 31st, 2019 is when the reporting is due for this period, March 1st through June 30th of this year. So you're going to have another 6 months to figure out the reporting, and we'll take you through, Ellen will take you through what that tracking and reporting sheet looks like. So again, this means that increases given between July 1, 2018 and August 31st, 2019 are allowable use, and you can count those as an appropriate use of your additional funds, even though you didn't start getting higher funds until March. You cannot count any funds given prior, or any wage increases, any health insurance increases, anything. You cannot count anything prior to June 30th, 2018. So even if you were an industry wage leader and you were paying $25 per hour for your staff prior to June 30th, 2018, I'm sorry to tell you, you still have to use the new funds for wage and compensation increases. You cannot, even though you were an industry leader and your folks were already very well paid, you still have to use the funds for those purposes after June 30th, 2018. Okay. Next up. So, who qualifies? Who at your agency can get the increase? Here is the definition. A worker who assists or supervises a worker to assist a person with an IDD to lead a fulfilling life in the community, okay, in all of these different ways, taking medication, going to work, etc. The DSP includes all workers categorized as program direct support professionals and excludes workers categorized as administrative. And administrative is defined in the FASB standards. All right, so what does that mean practically speaking? Here are the folks it does work for: DSP contractors and employees, so those are the direct on-the-ground staff. Yes, it does work for host home providers. They are included in the definition. You can give them an increase with these funds. Family caregivers as well, and importantly, DSP direct supervisors, okay? Who does it not work for? Case managers, administrative staff, executive staff, CFOs, CEOs, IT, HR, etc. Still not sure. We recognize a lot of quirky kind of definitions are out there, and everybody runs their agency slightly differently, and everybody has different titles and different things they call their staff. We went to one agency that had one person that sat at the front desk that had quite literally had 4 job titles, and I think one of them was like supreme grocery getter every Tuesday, czar. And so that's phenomenal, but what you are going to have to ask yourself is, do they meet this definition? And this is the HCPF FAQ definition that they tried to provide a little bit more support for you as you analyze this. So if audited, agencies are going to have to show the job description of the worker identified as a direct care or supervisor, that the worker identifies for as providing activities of daily living and instrumental activities of daily living, and that the worker performed these on a regular basis. And so what we want to tell you is the key word there is job description, all right? Please make sure that you are looking at the job descriptions of the folks you are determining as eligible at your agency. You want to make sure those job descriptions are up to date, that they are accurate and true, and that they really address these activities of daily living and instrumental activities of daily living, because that is what HCPF is going to be looking for when they're making sure that the DSPs you applied these funds to are appropriate for the purposes of the statute. Really think carefully about those job descriptions. It's a good time to do a review there. All right. Understanding the rate increase. How are we able to spend the money? Okay. The funds can be spent to increase total compensation as a direct benefit to the DSP. So that direct benefit is the critical component there. I'm really grateful to say that healthcare policy and financing spend quite a lot of time really dissecting what would be of the most value to the low-income population that is meant to receive these funds. They spend a lot of time working with us and other agencies to understand kind of how agencies are structured and how DSPs really find value in their job and especially in the compensation and financial component of their job. And so most benefits and wage are included in that definition, but they're really looking at making sure that the money went to a direct benefit to DSPs. So what does that mean? Compensation that is directly conferred onto a DSP for their sole benefit and does not include direct benefits to the employing or contracting service agency, which may have an indirect benefit to the DSP. All right, so what does that mean? That's a photo of you guys being incredibly flexible and executing this with beautiful precision. So you get to decide. The bottom line here is there's a ton of flexibility to make this practical at the local level and for your agencies, because HCPF recognizes that every agency is different and unique. So you at your agency get to decide the type of increase, meaning how much of this money goes to wages, how much goes to different types of benefits, and we'll get into the different types of benefits. As long as it meets that total compensation definition, you can decide the type of increase. You also can decide the amount of increase. You can decide your host home providers get a 3% increase, your day program providers get a 10% increase, your respite providers get a 7% increase, etc. You can also decide that, Billy Bob gets a 4% increase, and you can decide that Jenny Lou gets a 27% increase. You can absolutely decide. You are also allowed to decide which DSPs get what. So even though you have, a certain pool of eligible DSPs, you can decide, as I was just saying, which types of DSPs get more or less of the increased funding. You can also decide, that can be at a kind of programmatic level, that can be at an individual level, that can be performance-based, it can be incentive-based, it can be seniority-based. You can decide how you want to do that. You also have the option of not all eligible DSPs have to receive an increase. So if you have a particular program that's already very well funded and you're not having hiring and retention problems in your whatever homemaker program, I doubt that for any of you, but if you happen to be doing really well there, you don't have to increase those particular wages. You can push the money over into the parts of your program where you're having the most hiring and retention problems. So all eligible DSPs do not necessarily have to get an increase. All right, so tons and tons of flexibility there. I know that makes it a little more complicated for some agencies. We've had a couple agencies who are like, just give me a formula for how to do it. Well, there's a reason there's no formula. It's because the intent of this is to really make sure it's working in the specific way it needs to work to be best used at your agency. All right, so here's some examples. Allowable expenses, this is not comprehensive, but these are some excellent examples of things you can spend the money on. Hourly wage or salary increase. It is our hope and our preference that the bulk of the funding across the state is really spent on the hourly wage and salaries of direct support professionals. We want to be able to demonstrate that this bill and this incredible investment in this low-income population really, really demonstrated a powerful impact on true take-home wage for this low-income population. If we ever have a hope of a major infusion of money like this to this workforce again, we really are going to be able to need to demonstrate in the auditing that wages for this population went up. So anything you can do to push this money into the hands of your employees directly is huge. You are also allowed to spend the money on payroll taxes. However, you can only spend the money on payroll taxes that the amount proportionate to the wage or salary increase. So if you increase your DSPs by 10%, you will have a commensurate increase in payroll taxes. It is only that additional amount in payroll taxes that you are allowed to spend this additional funds on. So you cannot backfill your existing payroll taxes with this money. You also can increase contract payments for host home providers because, as we've said, they're included in the DSP definition. You can also spend this money on bonuses. We have heard from several agencies that at least for this first year, they're going to take the full amount of money at the very end. They're not going to do anything with it right now, but at the very end of the period, they're going to look at the entire amount that they actually billed and received. They're going to take that full pot of money and they're going to distribute it in bonuses to eligible staff. All right, so that is a totally allowable retrospective approach that you can use. You can also invest in retirement contributions on behalf of your DSP staff, including health savings and flex savings accounts. You can also invest in the health insurance for qualifying direct support staff. We particularly we have several agencies who've said, wow, especially on the Western Slope, our health insurance costs are going up and we don't want to push those on to staff, and so we're going to absorb those and use the money from the 1407 bill to pay for that. Or they're increasing the quality of their health insurance, or they're reducing the deductible for health insurance for eligible staff, and so they're going to use the 1407 funds to do that. You can increase benefits, reducing employee share premiums. You also can use the money for tuition reimbursement, but only if the DSP requests coaching to perform job duties. So this is not, you can't do it as an agency requirement, but if a DSP says, hey, I really want to learn more about how to do this particular part of my job, you can use the funds to really advance their skills and knowledge. You also can spend this on a PTO or vacation time, as was used in one of our examples. Okay, so what can't you do? Memberships like gym, yoga, Pilates, trips, retreats, vacations, no buying yachts or anything for your staff. Payroll taxes that are not proportionate to wage and salary increases. So this is what I was saying before. You can't spend it on backfilling your payroll taxes. You cannot, under any circumstances, spend it on executive or administrative salary. So be really clear about, the eligible pool of staff who can receive these funds. You cannot spend it on workers' compensation insurance. Healthcare Policy and Financing decided that did not qualify as a direct benefit to the employee because they might not ever use it, right? So they may not ever see the value and power of those funds, so it does not qualify. You cannot spend it on parties or employee appreciation events or gifts or activities not identifiable to a specific program. You also cannot spend it on HR, IT, admin, oversight, management in general, business management, budget and finance, contract staffing, general record keeping, all of that stuff that we totally recognize as critical and necessary expenditure. Money is not for that. You also, as we discussed earlier, received a 1% rate increase on all services. We recommend that you try to target that 1% on those types of overhead and admin activities and use this 6.5% exclusively as required in the statute on total compensation for eligible DSPs. Okay, I know that was a whole lot. Please, I hope you're submitting questions in there. I'm going to pass it over to Ellen. She's going to get into more of the accountability and the tracking and reporting and quite a lot more, so stick with us.
Thank you, Emma. All right, I hope you all are still awake and following. So let's talk about the accountability of this bill. In order to pass this legislation and get such a significant investment in our IDD services in Colorado, we had to include some pretty stringent accountability measures to make sure that we can show our legislators who voted for this effort that the funds were spent according to the legislative intent of the bill that they passed. So, in order to meet these accountability requirements, PASAs must track and report how they use the funds by the state fiscal year. As Emma's mentioned a couple of times, the state fiscal year runs from June 30th of a given year to the following year's July 1st. So we're currently in state fiscal year FY 18-19. You have to report annually for 3 years using HCPF's reporting tool. I'm going to show you HCPF's draft reporting tool in just a moment. But here are the deadlines for reporting. So for the state fiscal year 2018-19, the fiscal year that we're currently in, as Emma mentioned before, the first reporting deadline is December 31st of this year. And in reporting, you must demonstrate the compensation increases that you gave to qualifying direct support professionals according to the definition that we've been discussing. On December 31st of 2020, you need to report again for the next state fiscal year, 2019-20. In that fiscal year and the following one, you need to show that compensation increases were maintained. So I want to be clear that you don't have to provide additional increases above and beyond what you gave in 18-19, except to show that you maintained these compensation increases. Of course, we realize that you're probably going to need to continue to make increases to keep up with our, strong economy and maintain your recruiting and retention. But that is what is required, and that's the same for the following fiscal year. The final fiscal year in which a report is required, 2020 to 2021, you will report on December 31st of 2021 to show that those compensation increases were maintained. You must also maintain all books, accounting records, etc., anything that demonstrates how you use these funds for 3 years after the reporting deadline for each respective fiscal year. So go ahead and just plan to keep all of your records for a long time in order to make sure that when you report and if there is an audit that you have the right documentation to demonstrate to HCPF that you spent the money according to the law. You also must be willing to make the information available to HCPF at all reasonable times, and we'll get in a little bit more to how the auditing process will work, but first let's cover the draft reporting tool. I just took some sort of screenshots of it, that's why there's a big draft watermark over it, but this is the draft tool that HCPF has developed that it plans to use on December 31st for your first reporting period. There may still be some minor changes to this, but so far this is what they've given us. You will notice that as I go through this, that the reporting tool is tracking how you spent the increase in the aggregate, and I want to emphasize that. It is not going to ask you for any individual DSP's wages or compensation. It's not tracking things on an individual basis. So on the left of the screen, you'll see what is on the top of that reporting tool, which is basically just your agency's information, what waivers you billed for during the reporting period or the state fiscal year, as it's otherwise known, which of the targeted services you billed for. Those services listed are the only ones that received the 6.5% rate increase. And that is all HCPF is tracking with this reporting tool, not the other services that didn't get increased. On the right, you'll see that they're gathering some information about DSP retention. So, they want to get a sense of whether this effort, in fact, improved our workforce stability in Colorado. So they're going to be asking you the number of DSPs that you had, that you paid during the respective reporting periods, and the number that you had based on the baseline, just the number that you had, and so they'll be dividing that number to, be able to track your retention. They want to know your annual turnover rate for the fiscal year, and the number who were impacted by 14.7 who indicated leaving their position due to salary constraints throughout the fiscal year. And so that they'll be using those numbers to gather your annual turnover rate. Moving on, they're going to be asking you to provide the total amount of paid claims for the reporting fiscal year. Again, this is just for those targeted services that received a 6.5 increase. They're going to ask you what your total, that pot of money that we showed on the slide a few slides back, what was your total pot of money that you got that you're required to pass through? They're going to ask if there are any outstanding claims that you've not yet been paid for and how much those are. So they're leaving space to account for the fact that there's a lag time in billing and payment. And so then they're going to ask you how the total in wages, tips, and bonuses, and then other types. On the right hand of the screen, you'll see the other types of overall compensation that you're allowed to spend it on. So they want you to break it out according to those categories. And then finally, they'll ask you for the total amount passed through, and you'll have to show for the other types of fixed and variable benefits that aren't in those previous lists, like employer-paid health insurance and paid time off. They're going to ask you to break those out specifically as well. So they really want to get just your overall aggregate numbers for all of the different compensation categories that you're allowed to spend these dollars on. Finally, at the end of the tool, there is an attestation for your provider representative to sign, showing that all the information you've provided is true and accurate. And we, on one of the last slides in this presentation, we have links to this tool as well as a lot of the other resources that you need to fully understand this. So this isn't your only opportunity. We highly suggest that you go through and review this tool on your own time to make sure that you're prepared for what you need to report on in December. Okay, so what happens if an agency does not comply with the law? So we really want to emphasize here that it is certainly our preference and it is certainly HCPF's preference that no one needs to have funds recouped. In other words, we want to make sure that all the dollars that are available to be spent on DSP compensation are in fact spent on them. So this auditing and recoupment process is really, kind of a worst case scenario. It is pretty difficult given, all of the various ways that HCPF is offering providers to come into compliance. to wind up in a situation where you have to send money back. So the flow chart that you see on your screen represents the worst case scenario. So in the first instance on the left, if the PASA's reporting tool shows that they've failed to comply with spending all of the dollars, HCPF may choose to request additional information from your agency on how you spent that. And the draft rules that they've come up with state that they can basically access almost any of your agency records in order to get additional documentation for how you spent the increase. HCPF may, if it still determines that it looks like you haven't spent the dollars according to the law, they may notify you of their intent to recoup funds. They have 1 year from the reporting deadline for each fiscal year to provide an agency with a letter and notice of intent to recoup. Once that happens, the service agency or the PASA has 45 days from receiving the notice to either challenge HCPF's determination, provide information that demonstrates compliance, or submit a plan of correction to HCPF. Once they do the plan of correction, HCPF may accept it, they may request modifications, or they may reject the plan of correction. They also there's also an opportunity for a PASA to submit a revised plan of correction based on the items that HCPF identifies are not up to standard in their plan of correction. They can submit a new one with corrections. If all of these different avenues fail, HCPF will notify the PASA of their final determination that the funds were not spent according to their law, and then they will follow existing law for recoupments, and they will recoup any funds that were a result of the 6.5% increase that the agency did not spend on DSP compensation. So if you spent 50% of those dollars on DSP compensation, but you failed to spend the other 50% on compensation, all they're going to take back is the 50% that you did not spend on DSP compensation. This is a very simplified version of the recoupment process. We highly encourage you to see the draft rules that HCPF has written for the detailed timelines and a lot more information, and have those on file for your agency, so that if you get into a situation where you get audited, you have all of the dates and all of the sort of rights and responsibilities at hand. All right, we received a lot of questions in advance of this webinar, and so we want to try to tackle all of those questions. Hopefully once we get through all of these, it will handle most of the questions that are still out there. All right. First of all, how will agencies be allowed to allocate the new funds across different types of DSPs? Well, Emma talked about this in detail earlier. So you have flexibility. Remember that amazingly flexible woman at her computer. You have the flexibility to decide how you want to allocate this across different DSP types. So there's no set algorithm or rule about how you do that. What if your organization doesn't identify employees as DSPs? Like Emma said earlier, we have different job titles. You may not call them direct support professionals. That's okay. It's not about their official job title. It's about whether, based on their duties, they meet the definition of direct support professional that's provided in the statute. And that's what we gave you on a previous slide. What about a case where an owner administrator of a PASA also provides direct care? We know there are a lot of really small agencies out there, and you might be, the agency owner, but you also might do direct service provision. Well, again, you need to make sure that the job description of whichever employee or contractor you're questioning describes that they perform assistance or supervision with activities of daily living and instrumental activities of daily living on a regular basis. But being an owner or administrator of an agency doesn't necessarily exclude you from being able to have a compensation increase if you meet the definition of DSP otherwise. Do you have to give DSPs a 6.5% wage increase? No, I certainly hope that it's clear at this point that the 6.5% we've been talking about is an increase to the reimbursement rates. There is no requirement that you give a set percentage compensation increase to any direct support professional. Does each DSP have to receive the same increase in compensation? No. Again, you have flexibility to determine how you want to do that. What about people that you hire after the sort of baseline date of June 30th, 2018? Well, helpfully, HCPF has clarified that for any direct support professionals hired after June 30th, you will use the lowest compensation that you paid to a direct support professional of similar functions and duties on that date as the baseline compensation to compare that new employee's wages or compensation to. And that the same goes for, host home providers that may have been contracted after June 30th. HCPF has said again and again that they're willing to sort of talk through these nuances on an individual basis with agencies. So if you have some pretty complex scenarios and are having trouble figuring out the baseline, we can certainly help you connect with HCPF directly to figure those out. Can agencies hire new DSPs with these funds? So no, you cannot just spend the money on, hiring 10 new positions. You can certainly spend it on providing a compensation increase for 10 new hires using what I just talked about, the lowest compensation paid to DSPs of a similar function as of June 30th as the baseline date, but you can't just spend this on entirely new hires in and of themselves. Can the increased funding apply to the required increase in the minimum wage effective January 2019? Yes, absolutely. In one of the agency examples that Emma gave earlier, they have already done that. Any increases that were given between June 30th, 2018 and the end of this fiscal year, June 30th, 2019, qualify as increases under the law, as long as they're for qualified DSPs. Are service agencies penalized or rewarded for having high or low turnover rate? No, the information that HCPF is collecting on its reporting tool is really related to trying to see what the impact of this legislation is, but you will not have a penalty if you have a really high turnover rate. Should there be disbursement amounts in every compensation category? No, again, this falls into the under the topic of agency flexibility. You can decide if you want to spread it out across a variety of compensation categories or put it all into one, such as wages. If the agency fails to bill for services at the full rate or use the increased funding, are they subject to reporting and auditing? So there is an option for agencies to sort of functionally opt out of the compensation increase requirements of the law. If you chose to continue billing at the January 2019 rates and not take any of that money, you still have to report to HCPF and demonstrate that you didn't receive the funds and that you didn't spend them on DSP compensation. But you basically can functionally opt out of having to give the increase if you want to. It is certainly our preference and HCPF's preference that no agency would decide to do this, because we think that our direct support professionals are very deserving of increases, but that is an option. Would a service agency with multiple locations report on all locations in the aggregate or per individual location? The draft reporting tool that HCPF has developed lets you choose whether you're reporting based on one of your agency's locations or the entire agency. So you'll just indicate that on the top of that reporting tool, and then you'll fill it out accordingly. Will HCPF advise the remittance advice for providers? This is something that's been requested at a couple of the stakeholder meetings, and what we've heard from HCPF is that they are working on a solution that will allow providers to easily see what their revenues from these specific services are. However, they don't expect that to be ready by the end of this state fiscal year, and so you probably won't be able to use it to report on December 31st, 2019, but you should have it for the reporting in the following 2 years. All right, that was the section on the rate increase. We're going to quickly just go through the waiver resources, and then we've received some questions through the chat box, so we will attempt to answer some of those really quick at the end here. So I'm going to move quickly through these slides. As Emma mentioned, the other two things that this bill did were around increasing resources for people, primarily folks with aging caregivers or caregiver concerns. So the law funded 300 new non-emergency DD waiver resources from the top of the waiting list. This amount was related to the number of people on the waiting list we expected had aging caregivers, but these resources were not reserved for people with aging caregivers. They were authorized by the department on July 1st, 2018, and of these 300, plus an additional 10 that HCPF allocates monthly for turnover on the waiver, 66 people on the waiting list declined the resource, but 236 accepted it. And of that number, 169 have enrolled already. The remaining number in the list, we are still awaiting response from. All right, now let's talk about the new rules that HCPF has drafted to prevent caregiver crises. The law directed HCPF to revise their rules and make necessary changes to the waiver to add caregiver concerns to the list of DD emergency criteria to allow someone to get an emergency resource. The bill's fiscal note predicted that this would amount to an additional 150 emergency resources each year just for this purpose. These enrollments work just like any other emergency enrollment. This is sort of an oversimplified version of the process, but in general, people have to make case managers aware of the situation that might qualify them for an emergency resource. If the situation meets the emergency criteria articulated in rule, case managers will submit a request to HCPF for review, and if HCPF approves it, the enrollment process can begin. All right, now I just want to give you the detail of what the caregiver rules allow for emergency enrollments. So the proposed rules allow enrollment when the primary caregiver is no longer in the person's residence to provide care, is experiencing a chronic, long-term, or life-threatening physical or psychiatric condition that significantly limits their ability to provide care, or is otherwise incapacitated, is 65 or older and providing care poses an imminent risk to the health and welfare of the person or the caregiver, poses a threat to the health or safety of the person in services, or, this is sort of a little bit of a catch-all category, regardless of the caregiver's age and based on the recommendation of a professional, the primary caregiver cannot provide sufficient supervision to ensure the person's health and welfare. So this is a pretty comprehensive list of caregiver concerns that needed to be addressed, and we are thankful for the department including all of these in the rules. The proposed rule also makes a couple of changes that are not related to 1407, to the bill itself. Those include clarifying criteria for emergency enrollment due to homelessness and specifying that people have 30 days to either accept or decline an offer of enrollment. So when the CCB reaches out to someone on the waiting list and says, there's an enrollment available, do you want it or not, they have 30 days to say, yes, I accept it, or I decline it. But people can get a 30-day extension upon request if they need more time. And I want to emphasize that this does not set a timeline for a person to actually enroll, just to indicate acceptance or decline. And what this will help with is being able to more accurately predict how many people are going to be on the waiver and the costs. It's all related to the state budget as well, so I think that this will help streamline the enrollment process. All right, what are our next steps after we've talked about all of these items? This bill was really designed to just be the beginning, and in fact, in its legislative declaration, it talks about this investment being an initial one. We still have about roughly 3,000 people on the DD waiting list, and it continues to grow. We have a long way to go before we have a sustainable service system for people with IDD, and that relates to the perfect storm that we alluded to earlier. But how can provider agencies, case management agencies, and other stakeholders continue this momentum? First, implement the elements of this law with fidelity and demonstrate that these additional funds can improve lives. Like Emma said, we really need to show the General Assembly that this is an experiment that worked. We need to continue to think about long-term solutions that are possible in bite-sized pieces that the legislature can take on. We need to continue our collaborative grassroots efforts across diverse stakeholder groups. Like we did on this bill, a lot of diverse stakeholders came together and we proved that we can stand together on something that's important to our community. We need to continue educating legislators and think creatively about how to tackle large financial costs of serving people with IDD. Finally, please be prepared to participate in the upcoming NCI National Core Indicators Staff Stability Survey, which is another lesser-known component that's required by House Bill 1407. HCPF will be adding this to their National Core Indicators work, and it will help us to track long-term the stability of our DSP workforce in Colorado. Really quick, a shameless plug for Alliance membership. Our members enjoy access to full staff support throughout this implementation process. They get assistance from other member agencies with reporting and tracking. They, of course, participate in future planning and legislation for the IDD systems and much more. You can join us at the Alliance Summit, which this year is June 12th through the 14th. If you would like to, sorry about that, little animation issue there, but you can request an invitation to attend the Alliance Summit if you are a PASA by going to that link, or you can also contact our membership coordinator, Kylie Campbell, and there is her contact information for you. As promised, here's a slide which you'll be receiving after with the links to all the different resources we've talked about today so that you can read them at your leisure and have all the resources that you need to implement this law. So, thank you so much for participating. Emma and I are going to try to quickly cover a few questions that we received through the chat box, if they are ones that we can answer on the webinar today.
Okay, guys. Yeah, so I'm going to just we're over time already. I'm going to quickly burn through some of the questions in the chat box. I'm going to skip some if we are already in offline conversations with you about your question. If your question is unclear to us, we will try to follow up and see if we can find a way to get you an answer. Please feel free to email us if you feel like you still don't have an answer to your question, and we'll try to answer it, or we'll get you in touch with someone at HCPF who can help you. So let's move quickly through these. The total paid for CES and SLS waivers went up. What are the new totals? I think you're asking what the rate schedule is. We included a link to the rate schedule in the resources. So as Ellen says, you'll get an email with this PowerPoint and webinar, so you can click on the rate schedule in there.
I think you might be referring to the overall SPALs, and so the SPALs for the SLS waiver are included on that rate schedule. For CES, we are in conversations with HCPF about where the new overall spending limits are located, so that will come out with the resources after the fact.
Another question, are you going to go over a breakdown of staff that are considered DSPs? We already did that. Please let us know if you have further questions. There was a question about, can a one-person PASA with no employees get the increase? If so, how would you track the 6.5% as not going into business? I think we covered that, yes. A one-person PASA, if you're a one-man show and you're doing it all, or a one-woman show, you certainly can spend the 6.5% increase on you, since you are doing direct support. And that would qualify you. The entire 6.5% can go to your wage and compensation. Another question, do DSP managers or supervisors qualify for the 6.5% increase? We answered that as well. The answer is yes. There's a question about staff turnover in the
Yeah, so the question is how staff turnover is viewed, and so there's some question about, you know, when you have turnover for employees who are starting at the minimum wage and then you rehire that position later on. So for purposes of reporting this to HCPF, again, the reporting is in the aggregate, so you don't need to necessarily demonstrate on an individual basis, you know, whether, you know, a person who left the agency being paid, you know, $12 an hour, and then you hired a new, less experienced DSP in their place at $10 an hour. You don't necessarily have to prove on an individual basis how you figured that out. It's all in the aggregate. So I hope that answers that question.
Another question, I'm assuming a copy of our host home provider's contract will suffice as a job description for HCPF. We believe the answer to that is yes, but we'll try to get confirmation, but I think you should move forward assuming that will work. Another question, just to clarify, we can spend the entire 6.5% increase on the more traditional definition of DSPs, correct. This particular agency would like to hold off giving an increase to host home providers until July 2019. Yes, the answer to that is yes. You can decide which types of host home provider, or which types of DSPs get the increase and which don't. So you can give it all to host home providers. You can give none of it to host home providers. You can decide as you wish. Another question, can the funds be used for hiring a new DSP? I think Ellen covered that. The answer is no. Someone else said that they have tried billing recently and the rates were still kicking back to the old rates from January 2019. We will talk to HCPF about that again. For those of you who are having billing issues, I don't think Joanne will mind, so I'm going to go ahead and give out her email address. Joanne Svenningsson is a rock star at Healthcare Policy and Financing and will work very hard to make sure you get paid correctly as quickly as possible. Joanne's email address is joanne.svenningssen@state.co.us. Ellen just entered it into the chat box as well, so if you're having billing issues, please contact Joanne Svenningsson. The email is joanne.svenningssen@state.co.us. Someone asked, can the funds be used to pay an account or an accountant to configure the report? The answer is no. You cannot use the funds on any administrative tasks, even though they're associated with this funding. Somebody asked, is this a provider role? Is filling out the reporting tool a provider activity or a case manager activity? All provider agencies will have to fill out the report. So any entity that bills for these services will have to fill out the report. So it's not a case manager tool. It's incumbent on each agency. As I understand it, an agency can decline to receive the 6.5% increase. Is that true? I think Ellen answered this. The answer is yes, you can decline to get the increase and pass it on, but you will still have to fill out the reporting tool indicating that you did not want the increase and you did not pass it on. Someone asked for the recoupment. Would the amount recouped by the department in the event that they had to recoup funds, would it be taken back in a chunk or in a percentage? The total dollar amount that's misspent would be what they recoup. So if you receive $100,000 in additional revenue due to this increased reimbursement, and you appropriately and correctly spend $90,000 in alignment with the compensation definition and in alignment with the DSP definition, then they would recoup the $10,000 that you misspent. And that's assuming that you didn't want to do a plan of correction, or they didn't approve the plan of correction, or somehow something broke down along the way of that corrective process that Ellen went through. There's a question about host home providers reimbursement does not include FICA taxes. The agency will be taxed on the income increase. Is there an example of how to address this? So in our host home example from earlier, we had, using the example of a host home provider, let's say there's $100 for the, $100 is the amount that's received for a daily rate. Thank you, my brain. A daily rate for host home providers, and then you have your host home providers negotiated to get 70% of that rate. That would mean they get $70. In the New World Order, they're getting 6.5% on top of that, so they would get $74.55. The additional amount, because remember we said previously you'll still have to demonstrate that the entire $6.50 for that amount, for that daily rate, went to DSPs. So you could use that additional amount, that additional dollar or whatever, to cover the increased FICA obligation for the agency. We can talk more about, please email us if you have some confusion about how that works, but we can talk through that a little bit more with you. There's another question about the 1% additional increase on July 1st. Does that need to be spent in the same manner as the 6.5% increase? The critical answer here is no. The 1% increase that went into effect last July 1st of 2018 can be spent as needed for agency use. So that can be overhead, that can be whatever you need. So that's a typical standard rate increase as you have received in prior years. The same is true for the rate increase that you will get this July. So now that the budget is nearly complete, they closed the budget, they still have to pass it through law and has to be signed by the governor, but assuming all holds true, which we expect it will, the 1% increase that you get on July 1st of 2019 can also be spent in any manner that you wish. It does not have to be spent exclusively on DSP compensation.
Okay. All right. We had one more question come through. Is there a penalty fee on top of 6.5 if you have to return funds at the end of the year? My understanding is no. However, the recoupment process that HCPF will use is the one that they use for all Medicaid billed claims. It's currently in the statute. We can certainly send out the link to that section in our follow-up materials, and we can also get confirmation from HCPF on that. I think we'll stop answering questions at this point, and if we have additional ones that come in after the webinar, we can certainly send out the answers with our materials. As a reminder, as we said at the beginning, the recording of this presentation as well as the PowerPoint slides will be posted on our IDD training page under the membership tab of the homepage of Alliance's website, alliancecolorado.org. We'll also email out the PowerPoint recording and the questions and answers to all attendees in the next couple of days. Thank you very much for participating, and we look forward to this bill being a success and working with you on that.